Welcome everyone to the climate and health responder course. Today we'll be looking at session number 3, which will be dedicated to water and food related uh, 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 illnesses. My name is Dr. Sean Patrick. I'm from the School of Health Systems and Public Health at the University of Pretoria. I'm also the Vice President of the Association of Schools of Public Health. Just a few reminders for you. The presentation or the presentations for today will be, there will be a translation both in French and in Portuguese. So please make sure that you are able to navigate to the button at the bottom, and then you can either select the interpretation either in French or in Portuguese. So this particular session is the third one, and please be reminded that if you are struggling to find the link, your links are all individual. So please revert back to the first emails that you have received when you registered for the course. Please navigate to that specific link, and that will be the same link that you will use for the entire course. So for today, the session will be 90 minutes. When the session is completed, some of your questions will then be addressed to the two speakers we will have. Please be reminded that you can enter your questions for the presenters, and you'll see there's a button for your questions and your answers. And when the session is done, the video recordings, the slide decks, as well as the resources will also be made available for you in the course website. The learning objectives for session 3. So when the session is done, you should be able to describe how climate change can influence the hydrosphere, including droughts, heavy precipitation, including implications for water availability, quality, as well as the supply. Be able to identify biological, social, economic, and structural factors that either make an individual or population more vulnerable to the impacts related to climate change, to the hydrosphere. You also be able to apply this knowledge of the impacts of the climate on the hydrological cycle and to the incidence of the prevalence of some of the waterborne pathogens. And then lastly, we're able to describe how climate change affects all 4 dimensions of food security, including food availability, stability of food supplies, access to food, and food utilization. So for this particular session number 3, we'll have 2 speakers, and I'll introduce each one of the speakers. Firstly, we'll have Dr. Martin, who is from is Program Director of Population Health and Environment. And then thereafter, we will listen to Dr. Frederick, who will talk, who is Director of Public Health Research Informatics at the National Public Health Institute, Ministry of Kenya. So before Dr. Martin starts, I'll just briefly introduce him and share his bio with you. So Dr. Martin is the Program Director, Population Health and Environment. He is globally recognized as a leader in the fields of climate change, health, public health security, water sanitation, and hygiene, as well as neglected tropical diseases. His contributions have significantly influenced research and policies in public health, and he's regularly consulted by the WHO. He is also acts as a technical advisor for climate change neglected tropical diseases and WASH, and he provides strategic support for more than quite a large number of countries in the African continent. He also has conducted quite a large number of research studies and evaluations, and has published quite a large number of research papers. So as we start the lecture for this session, please welcome Dr. Martin. Dr. Martin?
Yeah, thank you. Thank you so much, Sean, and happy to be here. So, colleagues, allow me to share my screen because I understand that we have 40 minutes with you. Just give me a second. Just to share this. Dr. Sean, please confirm that you can see my screen.
Yes, I can. I can see your screen.
Okay. Then I'll go to the presentation mode.
Thank you very much.
So good. So let us begin this. And it's really very exciting to speak about how climate change is impacting matters WASH. But for today, we are going to capitalize our conversation on just a couple of things. First of all, looking at the hydrosphere and how climate change is actually impacting issues to do with water availability, its quality, and we are going to also speak about issues to do with how that is affecting access to food. So, but before we dive into the topic today, I would want to say some few things. That water is the main medium through which the impacts of climate change are felt. In many circumstances, we are either having droughts, especially in Africa. That is the situations where you don't have water. And to the converse, you have a lot of water in the form of floods. So in short, water becomes one of the main mediums through which we feel climate change. And then there's something else which I always like speaking about, that water is a source of life. And we know that for you to sustain life, water is actually needed. But it's also a very powerful force, which potentially causes loss. So through those two key arguments, I would want to dive into topic number one. Basically, I'll be diving into 4 topics, all of them cut into sections, which will help us to understand this subject in a deeper way. So I'll begin by speaking about the impacts of climate change on hydrosphere, just looking at the droughts, precipitation, and their implication on water quality, its availability, and the supply systems. So, and below, and I do hope these trends are going to be shared, I'll just speak about those 2 key pointers, which are just here. Allow me to begin by defining one term, because it's necessary for everyone to understand. When we are talking about hydrosphere, we are talking about the water that is found within the Earth surface. And I would want to reference some statistics and say about 71% of the Earth's surface is covered by water. And then oceans normally carry under 7.5% of that water. So what is available as fresh water is around 2.5%. So you can imagine in your mind how much water is available for us to utilize without the need for treatment. Then the second thing I want to just reference, these are quick statistics, is that we know that Africa has significant amount of freshwater resources, but they are so much unevenly distributed. And that's why you normally find deserts in many circumstances. And of course, there are the rainforests like what we have in Congo, etc. So the key pointer here is that although we have some significant resources of water in Africa, that water is not available for use by everyone. Then the other key issue that I want to point out is around the issues around water scarcity. And I'll talk about key drivers here of water scarcity. The first one being climate change. I described the issues around droughts. And apart from droughts, when you have floods, then we have contamination. So quality is affected. And therefore, the availability of water is compromised. Of course, there are issues to do with the population growth. When we become more, then the demand for water goes up. And so for that case, the population growth affects water in a very indirect way. Then lastly, it's all about the water sanitation and hygiene infrastructure, which goes with poverty, economic index, etc. I'll speak about agriculture and health in details later in the other slides, so allow me to just skip that explanation right now. So I'll speak about this slide here, which is basically a demonstration of what many of us went through geographic classes, interacted with. And I begin by speaking about the sun, which normally activates the entire hydrologic cycle. And just speaking about it from a very simplistic manner, the sun hits the ocean, evaporation happens, condensation. Once evaporation happens, condensation happens, and then we have what we normally call precipitation. But before I speak about precipitation, just know that there are other processes which normally make water to rise, mostly around transpiration or whatever we normally call evapotranspiration. Then we have precipitation, and after the condensation of water, we normally have precipitation in the form of rains, snow, etc. And once that happens, then water comes down again. We get that water either as underground water, surface water, that same water goes to the oceans, etc. So, and in this case, many circumstances, we have fresh water. And again, the water which gets into the big water body masses, again, becomes, water which has salt or water which cannot be easily utilized. Now, within this mix, if you introduce the element of climate change, in simple terms, we are saying you distort the cycle. When global warming happens, then you have the weather patterns naturally changing. And as I said earlier on, water is the main medium through which we experience climate change. So you either get a lot of water in the form of rains, or you are going to get little water, and sometimes you get droughts and desertification thereafter. Now, having spoken about how the hydrologic cycle normally happens, I would want to speak about the factors that exacerbate the vulnerabilities of population to the health impacts of climate change, and of course, related with water. And in this case, I'll speak about two main things here. The first one is I'll be analyzing the biologic, socio-economic factors that affect population's vulnerability. And then we are going to examine the structural and environmental factors that increase the health risks. From basic terms and from the basics of epidemiology, you know the time, place, and person principle. So I'll begin by talking about the person, the biology of the person. And in this case, of course, within the person, there's the age, there's the immunity, and we know that the elderly and the children are the most susceptible to infections, and it's because of their immunocompromised situation. Not necessarily because of other conditions, but simply because that's what the biology is. We all know that children, and this is in the statistics, are actually so much vulnerable to diarrhea and diseases. Indeed, this is one of the main killers in Africa. I'll speak about the social factors, which is more or less of education. And we know that education is actually a problem in Africa, with about 34% being illiterate in Africa. So the connotation is when you don't have the understanding about all these things, about how infections normally happen, then there's a big problem there. The other unfortunate issue is that we have gender inequalities. We know that women actually suffer loss of labor. They are the ones who are most vulnerable to impacts of climate change. At the same time, there is the element of gender-based violence. And because of the kind of interactions that they have with water, they are more susceptible or more subjected to waterborne diseases. Of course, there is the culture element, which actually speaks to the issue around utilization of water and sanitation services across the continent. I'll move on to speak about the structural factors, and in this case, I'll be talking about the climate variability, and this is all about the stresses which we normally get because of the changes of the weather pattern. And when we say climate change, it just simply means that over a long time, there's a variant kind of weather patterns that is inconsistent with what we were experiencing in the past. The other issues is around the infrastructure. We all know that about 300 people in Africa are lacking access to safe water services. And that is so huge. We are talking about urbanization and urban slums, and especially where we are having overcrowded slums, of course, with poor sanitation, and that leads to like contamination of the water sources and thereby leading to waterborne diseases. We are talking about the policy gaps. We are talking about the governance gaps. How we are organized, the roles that are available, the enabling environment that helps us to address these challenges. Then conflict and political instability that is actually driven by water in some circumstances or lack of water. So this exacerbates the vulnerabilities of communities when you're talking about it from the population health perspective. Poverty is the other issue. And the key thing here is the willingness and ability to pay for water and sanitation services. If you look at most of the policies, they are talking about communities or populations being asked to pay for water services, but are they able and are they willing to pay for those services? Yeah, I spoke about the inadequate infrastructure earlier on, and especially for the treatment of water, whether we are talking about primary or secondary treatment. And at the end of the day, when you put the factor of cost within the healthcare services, we all know that it is so expensive to access health in Africa. So you can see all these vulnerabilities and how they interconnect to make it very difficult, and starting with water, access to water, sanitation and hygiene, and of course, exacerbated by climate change issues. I'll go to topic number 3, and in this, I'll be examining the impacts of climate change on the hydrologic cycle and its role in the spread of pathogens. In this case, I'll be trying to connect the dots between the hydrologic cycle and the pathogen, and the pathogens and how they spread. Let me say that when you are looking at the two main spreaders of infections from whatever we ingest, we normally say that water can be a super spreader of infections. And food localizes those infections, but water spreads those infections. So when speaking to this, I'll take the dimensions of what we normally call the waterborne diseases. Waterborne diseases are those diseases which are actually carried, or pathogens that are carried by water. And so when you ingest that water, you get to be infected. Water-based diseases are diseases which, by the virtue of an intermediate host or an intermediate host being in water, then water becomes a medium through which that disease is transmitted, like schistosomiasis or bilharzia in simple terms. Then the other dimension is what we call the water host diseases. Water host diseases are the diseases which, or the infections or infestations that you can simply deal with by just washing yourself. Then lastly, I'll be talking about the diseases that are related to water. Water-related diseases are like vector-borne diseases, whereby water becomes a medium through which the vector is going to proliferate and then spread the diseases. So what are these factors? I want to speak about factor number one, which is increased temperature. And of course, global warming happens because of climate. It's actually the main driver of climate change. We are experiencing climate change because we are having global warming. And what is happening is that we are having increased temperatures. And so for that case, what happens is that temperatures up to the optimal kind of situations increase the survivorship and the proliferation of pathogens. And this one has been shown very clearly with species like Vibrio cholerae, which causes cholera. Then the second thing is that when we have climate change, ice caps are melting, we have more precipitation, then we have sea level rising. What happens is that salt water intrudes into the freshwater system. And when that happens, then new ecologies are created, and that provides a better environment for what we call halogens or salt-loving pathogens to thrive better. Then the other issue is around, of course, the alternate precipitation, flooding. I spoke about it, overwhelming the sanitation systems. Then we have contamination of water lines. And of course, pathogens ingress into fresh water. Droughts. When we have droughts, we have little water to use. And when you are talking about water-washed diseases and waterborne diseases, then you realize that we have a problem with that. Because without water, then there are so many infestations which you can't wash off. We are talking about glacier melting. And when that happens, you open boxes which should have not been opened, exposing pathogens. And that has been shown, like with the case of anthrax outbreak, anthracosis. And this was documented in Siberia that led to infection of 72 people. We are talking about the impacts of water quality. And in this case, if you take the dimension of surface runoff, where nutrients are washed off from the soils to the water bodies, and then this algal bloom becomes toxic, and especially to animals and to people. And there's a case which has been clearly documented in Kenya, where I come from. Of course, there's the extreme weather events like cyclones, which are related to climate change and water, directly washing off the infrastructure, and sometimes actually promoting, the spread of all these kind of infections. Then the other issue, which I also alluded further, is the issue around urbanization and climate change. So what we are saying here is like rapid urbanization combined with climate change can exacerbate the spread of waterborne diseases. And I wouldn't want to really overemphasize this, but there are very clear kind of statistics which are alluding to the fact that urban populations in Africa exposed to unsafe water are expected to grow by 60% by the year 2050. This is quite alarming. it's quite alarming, and therefore we need to start already thinking about how we are going to address such kind of challenges. So now, allow me to speak about all this and the public health together with policy implication. So the first element that I want to draw your attention to is the need for improved water infrastructure. And this is to mitigate against the impacts of climate change. And as much as possible, I always say that it is time now that we started implementing infrastructure that is green, the one which doesn't promote additional release of greenhouse gases, thereby helping to address the issues of global warming. Then the second thing, which is so important, is to have a strong, responsive surveillance system that can tell us the true pictures about the potential for outbreaks and how best to deal with them from the time, place, and person perspective. Then the other thing is around public health communication, the risk communication and community engagement. We need to be apt, we need to have fit for purpose messages. We need to orient our engagement with our communities so that we become effective, address the issues of knowledge, noting the statistics which I spoke about in terms of illiteracy levels. Now, I'll go to the last topic, which is just speaking about how climate change is affecting the 4 dimensions of food security. And for that case, the 4 dimensions of food security is the availability, the access to the food, the utilization, and the stability of the food security. Matthew, most of the food that we eat in Africa is produced through rain-fed agriculture. Because I spoke about water being the main medium through which we feel climate change, when we are talking about point number 1 around food availability, we are talking about that physical presence of sufficient quality food at all levels, whether it is at national level, regional, global. When we are talking about access to food, it's a combination of economic resources, the physical access, the sociocultural issues around the restriction of how we eat our food and how we access it. When you're talking about food utilization, it's more or less of inherent, but it is driven by how we prepare that food, how diverse the diet is, and how that food is distributed even within the household itself. And lastly, when I'm talking about the stability of food access, we are talking about the consistency of availability and access and utilization of food over time. So on food availability, the key issues here is, I spoke about water and the impact thereof or lack of water in terms of crop yields. And we have seen a couple of statistics here that in some crops we are experiencing as much as 6% drop simply because of temperature changes. We are talking about change in precipitation patterns, and this again has major impacts in terms of how we are producing food through the rain-fed agriculture. We are talking about fish here in this case, and statistics show that about 10 to 58% reduction in global fish catches by the end of the century. It's a postulate. And this is as a result of acidification or just the change of ecology of the natural breeding sources of the water. When you're talking about stability of food, we are talking about issues to do with natural disasters that either lead to, distortion of transport systems, etc. We are also talking about pest and diseases outbreaks. We are saying that this either, the change of weather patterns could, increase the risk of pests and diseases among crops. We are talking about seasonal variability and how long it takes for us to produce a particular crop or food. And because of these cyclic unpredicted changes, then we have problems with the stability of food production or accessibility thereof. Then when we are talking about the access, I spoke about the economic issues, the hardship that climate change is actually becoming, which climate change is bringing onto the table, pushing the food prices up. We've seen this happening post-COVID. We are talking about issues of loss of livelihoods as a result of the rain-fed agriculture issues. We are talking about infrastructural damages. We are talking about issues to do with displacements, either because of the rising sea levels, flooding of rivers, and we have seen all these things actually happening to communities which live along the riparian or the lake regions. When we are talking about the utilization, there are some researches which have already been done. And first of all, the nutritional quality has been shown to already start deteriorating as a result of increased carbon dioxide in the atmosphere and many other factors that are associated with climate change and air pollution. Then we are talking about, when we are looking at nutritional quality and seasonal variability, crops, just like human beings, thrive within certain parameters. When those parameters are distorted, then you have all these issues giving us some sort of problems. We are talking about water. Water is the main medium, water for life, I mean. And water for life here is even after you eat, water then becomes a compulsory nutrient. And if this water is contaminated with pathogens, then foodborne illnesses follow. So we cannot delink the issue of access to water and sanitation because the two are so coupled in a way that you cannot dissociate them. And in circumstances where we have wash-offs, where we don't have water, where we have our water bodies getting contaminated, then you have that cyclic kind of impacts in terms of the access to water, the sanitation issues, economy, and health. So I want to sum up this conversation by trying to summarize the key things that we must do. The thing is, we must shape our future. If we don't do that, then we are going to continue in the pity that we are experiencing right now. But what should we do? I tried to summarize this in terms of things which you can easily remember. So I called it shape. The first thing is to strengthen water resource management and its infrastructure. And there is a whole set of activities here: organizing communities, having the right policies, making sure that we are all engaged in a way that we can manage our water systems and the infrastructure thereof better and expand them where needed. Then, with regard to the health systems, we need to build stronger, resilient health systems that are resilient to the impacts of climate change and that can be able to handle waterborne diseases in a better way. We have very clear guidance that is available by the WHO in terms of building climate resilient low carbon health systems. After this, you should be able to go and read more about what we need to do in terms of energy transition, becoming more efficient and all that. Then the other thing which I alluded is issues to do with risk communication and community engagement, having novel tools, new methods of communication, and engaging the communities in the best way that can happen. Surveillance cannot be underestimated, promoting integrated surveillance systems and early warning systems. How do we bring all these surveillance systems into one basket and utilize it effectively to address the challenges that we are facing as a result of climate change and its impacts on water? Then the last thing, partnerships, collaborations as the new innovation. That is the only way that we are going to handle this complex issue of climate change and health. Thank you so much. That is what I had prepared for you, and looking forward to interact with you during the questions. Thank you.
Thank you, Dr. Martin, for a wonderful start to the session and for placing the subject into a local context as well as in a context that's more global. Thank you for that. We do have a number of questions. So as soon as the next speaker is done, I will then address these questions to you to answer. So thank you very much. The next speaker we have, Dr. Frederick, is the Director of Public Health Research Informatics at the National Public Health Institute in Kenya. He's actually the first pharmacist to graduate from the field epidemiology laboratory training program called FELTIP. He's a widely published PhD student and is a co-investigator on quite a large number of research projects, particularly in controlling climate sensitive infectious diseases. Previously, he was a pioneer lead for the National Public Health Institute National Strategic Stockpiles and Product Safety. In addition, he's director of the Public Health and Sanitation, and is an epidemiologist in the National Malaria Control Program. And he will today share with us a practical example of some of his work. Dr. Frederick, over to you. We have 20 minutes.
Thank you. Thank you, everyone. Let me just try to share my screen. I hope it can be seen now.
Yes, please go ahead. We can see your screen.
All right, perfect. So thank you for the kind introduction. My name is Dr. Frederick Oma from Kenya. I'll be making this presentation on behalf of Dr. Kimenye, who is the Director General for the Kenya National Public Health Institute. She was supposed to make this presentation, but due to some international travel and connection problems, she's not able to join us today. So my presentation will be in this outline. I'll briefly mention something about El Nino phenomenon in Kenya, then something on public health impacts of climate change. Then we go to the case study of Lamu County in Kenya, which is the main, the gist of this presentation, really. Then factors increasing population vulnerability to health impacts of climate change, which I'm glad the previous speaker, Dr. Martin, has largely covered. And we'll go to a brief conclusion. Then, as a good feature, I'll mention something on a brief quiz for everyone. So, as alluded to by the previous speaker, issues with climate change, a lot of times they affect water. In our case, we've had quite a challenge with flooding in the recent times, with the El Nino phenomenon, which is known to most of us, being experienced in the country almost every 2 to 7 years. Within 2 to 7 years, we get to experience an El Nino phenomenon in Kenya. And this has come with a lot of challenges, resulting in heavy rainfall and causing floods that affect most parts of the country. One of the most intense El Ninos to be experienced in the country was 1997 to 1998, which caused quite some great havoc. But last year, we also experienced the El Nino in the country, as I'll show you a bit later. We've had this El Nino phenomenon being experienced quite a number of times during the years that are just shown there, 2002, 2004, 2005, again in 2006, 2009, 2014, and then now the most recent being last year, 2023. So the El Nino, as you are aware, is usually followed by prolonged drought. So this comes as a challenge, as alluded to by Dr. Martin. We start with the problem of too much water, then followed by insufficient water. So some of the impacts that have already been alluded to include the water-related diseases, the waterborne diseases, vector-borne diseases. But we've also experienced quite a number of challenges related to supply chain, particularly when we are unable to deliver health products and technologies to health facilities and communities where they are needed, because either the infrastructure has been destroyed or there's a massive flooding, and therefore transport is a challenge to various parts of the country. We've also experienced quite some constraints in the routine referral medical emergencies, where ambulances are not even able to move from one facility to another to refer cases. In addition, there's been prolonged power failure in health facilities that have resulted to various challenges. As you're aware, health facilities require electricity for many needs. So this has led to a lot of challenges in the country. There's also been reported many cases of trauma and drowning of the population. So this also being a great public health problem, and prolonged dry seasons that have led to allergy pollutants, which basically reduce the quality of air and cause a lot of respiratory illnesses. So as you can see in this picture, just again, this is taken from the recent issue in Lamu County, which I'll show you briefly. We had flooding that has led to a lot of challenges. And one of the challenges that we experience whenever there's flooding, as you can see in the top right corner, there's the communities, particularly in Lamu County and a few counties in the coastal parts of Kenya, that have the culture of digging their wells close to the houses. And a lot of times you find that there are also pit latrines that are dug close to the houses. In the picture there, you can see there's a case of a well being within a 1 meter radius of a pit latrine for the same household. And there's another pit latrine which is barely 4 meters away for a different household. And this, we witness a lot of cholera cases spread in this particular area, which will easily be attributed to the flooding, water overflowing in between the well and the pit latrine. So this has caused a lot of challenges, particularly in areas with high population density, whenever there's flooding, in areas with the high water table, like in the coastal regions of Kenya, places where there are shallow wells, pit latrines, and those kind of challenges. Now, between October 2023 and January 2024, we experienced the El Nino phenomenon in Kenya. By the 5th of February, when we were just aggregating this data, there were a total of 378 reported cholera cases, of which 22 were confirmed by culture and the rest by rapid diagnostic test kits. And we reported a total of 4 deaths from cholera. Meanwhile, there are also other diseases that were causing problems across the country, including Rift Valley fever, malaria, among others. Now, apart from the El Nino that was experienced there, between March and May this year, again, we experienced our long rain season. Usually March to May is the long rain season in most parts of Kenya. We refer to it as the MAM period. And during this period, we had reported 53 cholera cases, 4 of which were confirmed by culture. And the they were disproportionately affecting children, particularly children aged 1 to 10 years, formed 54% of the cases that were reported. And for some reason that might interest us, that is actually calling for further research. 55% of these cases were males. So we are seeing more of younger children, including those aged under 1 year, being confirmed to be having cholera, which is a bit unusual based on the WHO case definition for cholera. It's unusual for people to look for cholera in children of that age, but these were confirmed. So we also had other challenges that were associated with this cholera outbreak and the heavy rain situation. So it was just the usual long rains, but this time it was heavier than normal and caused widespread flooding across the country, leading to a lot of challenges, including boreholes that were being affected, water sources for at least 2 of the 47 counties in Kenya were totally destroyed. So there was a lack of water in a number of parts of the country. In total, 41 counties out of the 47 in Kenya were affected by the flooding and heavy rain situation in this period of March to May of this year. So there are other public health impacts of climate change that have already been alluded to. Most of them related to wash, water, sanitation, and hygiene. Some related to nutritional challenges, food safety issues, and a common issue that is coming up, the issue of misinformation and disinformation, which I think can be discussed in another forum, but it's becoming a problem even as far as climate change is concerned. Just yesterday, somebody was telling me that climate change is a scam. I think sometimes people have a lot of theories about some of these things. So misinformation, disinformation becomes a big problem. Now, this is just a simple picture showing the kind of flooding that occurred in most parts of the country. This is within the coastal region. Quite some economic losses resulted from this. As you can see, this is a major highway that was totally cut off by the flooding. And populations being displaced during the flooding, leading to further challenges, when they had to be accommodated in camps for internally displaced persons. So this led to a lot of challenges. As you can see, there is a lot of destruction of infrastructure, including human dwellings, as well as health facilities. The issue in Lamu, now Lamu is a county. Kenya is divided administratively into 47 counties, which are semi-autonomous regions. Now, Lamu County is along Kenya's north coast, a coastal region, basically more to the southern part of Kenya. Now, the population density in Lamu is quite high, and it's largely an island, although it has also a portion that is part of the mainland. Actually, several islands that form part of the county. It neighbors Somali to the northeastern side. Now, the Lamu Island usually experiences inadequate water supply. Most parts of the county do not have piped for fresh water supply. So therefore, issues of water and food insecurity are common challenges in the county. And issues of management of sewage across the country, the county is really a challenge, based on the fact that, again, most of it is an island and the population density is very high. So another common problem that we saw in Lamu is that most of the buildings have protected wells, like we see in the photo, and shallow wells are quite common because the water table, it's pretty high. During the period when we had this outbreak, we sampled some water from various sources within the county, 28 water samples to be specific, and we analyzing for various pathogens, including coliforms and E. coli. And of these, 92%, or close to 93%, were actually found to be unfit for human consumption, meaning that the residents there were consuming water that was contaminated with either coliforms or E. coli or both. So one of the challenges that we had to contend with was the whole infrastructural setup of the place, the lack of piped, safe drinking water, the fact that it is detached from, most part of the county is actually detached from the mainland, and there is no vehicle transport within the island. Transportation is only by animals like donkeys. So that makes it quite a challenge. Even distributing water within the county itself. About 86% were found to have E. coli on culture. So this epicurve basically shows where the prolonged rainfall started, sometime in October when the El Nino started. Then, as you can see, the index case was reported around 26th of October. Then by 8th of November, we were declaring an outbreak in that area. The cases now started rising quite drastically from there. Then at some point in late November, there was an annual cultural festival for Muslims, which is an annual festival that occurs in that county that attracts people from across the country and the globe. It's really an international festival that attracts a lot of tourists to that place. So that was followed quickly by a sudden rise in the number of cases, including some mortalities being reported. So we conducted some map investigation in the area. Now, this next slide just shows a map of Kenya that gives you a picture of where Lamu County is at it's more to the southeastern side. So that whole area is the coastal area, which covers the counties of Kwale, right at the bottom tip, Kilifi, Tana River to some extent, and Lamu. So Lamu, based on its position and the fact that most of it is an island, tends to experience most of these challenges with water, sanitation, and hygiene. And the interesting thing about the outbreak we had in Lamu was that only 2 wards, which are small administrative units. So the way the country is divided, we have counties, then sub-counties, followed by wards, which are now the much smaller administrative units. So it's only 2 wards within this county that had these cases. Most of them are revolving around here. And these are the wards that had hosted the Lamu Cultural Festival and also some other events that seem to have occurred around the same time. But in the map of Kenya, the larger map, you can see the cases were reported in quite a number of counties, not just in Lamu. Now, on the northern and particularly northeastern parts of the country, the larger part of the northern part of the country is arid and semi-arid lands. So cholera was also spread around the same time because of the situation that was there, sudden water that was flowing, and population movement, and a lot of other challenges that contributed to this around that time. This is just a picture of a health facility that was submerged by water in the country. This was the case in several parts of the country. Actually, 70 health facilities were affected to different extents, some having their roofs destroyed, some having accessibility to the facility totally hampered by destruction of the roads. Others were totally marooned by water and people could not access them, and various other issues. So in some cases, we had to set up temporary facilities to attend to the health needs of the population. So we have all these challenges, particularly referring to the issue in Lamu, drought and water scarcity, both leading to issues of unsafe water, infrastructural disruptions. We've had challenges with the sudden proliferation of the Vibrio cholerae that causes cholera. Sorry about the spelling issue. Now, flooding that overwhelms the drainage systems, that increases vector breeding, which, as mentioned earlier, by my co-presenter that can lead to vector-borne diseases like malaria and other diseases like viruses, dengue fever, chikungunya, and other diseases like Rift Valley fever that are also transmitted by mosquitoes, as well as other vectors of the disease they cause. So increased temperatures whenever we have an El Nino, shortly followed by a long drought leading to these increased temperatures, that also somehow promotes bacterial growth. Displacement of populations leading to wash challenges. I mean, we are still grappling with ensuring that we restore water sanitation hygiene in most parts of the country that were affected by these flooding issues, and particularly Lamu County, where we continue to support them with the wash facilities and supplies. There's been a lot of disruptions in routine health services, loss of livelihoods leading to malnutrition, and other challenges like reduced health seeking, reduced food security. I mean, I don't want to dwell on that. It has been covered quite well. So in conclusion, climate change leads to heavy precipitation and droughts. And a lot of times it's above average rainfall caused by this heavy precipitation. And the droughts themselves lead to direct and indirect health impacts, including outbreaks of various diseases, injuries, infrastructure destruction, and economic losses to the country. And when I talk about the country here, in this case, we know that most of our countries in the global south are more or less similar in terms of the challenges that they face. Now, there's a need to establish early warning systems for climate-sensitive diseases so that we can have ways of predicting these diseases before they actually occur and taking appropriate measures to combat them. We also need to develop programs that seek to build resilience in the communities, as well as developing systems to improve food security and food safety, so that whenever these things occur, we can have a very organized and coordinated way of handling them. So that will be the end of my presentation. This is just a quick quiz, just referring us to the session learning objectives. Thank you very much. I'll stop at that point.
Thank you, Dr. Frederick, for an extremely well presented presentation, and really to give us a practical example of. In the first speaker, we really heard about more of the understanding of the topic, but really to give us a real life explanation. We actually can see these issues that we have that are playing out in reality. First, let me just say thank you to our two speakers for quite a comprehensive discussion on the topic. For Dr. Martin for placing it into context, and Dr. Martin, I just want to say thank you especially for your last slide. We actually summarize everything into one slide and actually ask us to think, how do we move forward and how do we actually try and put these into perspective? So based on that, there are quite a number of questions. So Dr. Martin, I'll start with you. One of the questions from the speakers were, in countries where waterborne and vector-borne diseases are, if they are endemic in the country, and previous information, it's either non-existent. How does one then proceed to determine the role of climate change and occurrence or an increase in these types of diseases? We don't really have any of the facts or the information.
Yeah, sure. Thank you so much. So let me begin by saying that there are so many things which are interconnected. And so in many circumstances, you may try to draw conclusions which are actually not true. But the facts are climate change is associated with net negative effects. And if you look at the trends, epidemiological trends, we are able to associate the different weather patterns that are being experienced and the increased kind of disease patterns. And when I'm talking about disease patterns, in this case, I'm talking about water-washed, water-related, water-based infections. And so for that case, it's a general kind of allusion. I'll end by saying that in Africa, we sincerely need to undertake a lot of research to connect the dots between the phenomena that we are experiencing with the actual climate change. And I'm happy to report that we have investments. The organization which I'm working with, together with the University of Botswana and others, have been funded by the INDRC to set research hubs, which are going to help us to navigate this and answer such kind of questions in a more specific way. Thank you.
Thank you very much. I think that, you know, one of the objectives of this course really is that we build the capacity, and that we also you know, share the information. I think you know, these types of initiatives, whether these hubs, are quite important. So where do you think should the priority lie in some of these let's say programs or these hubs as far as public health is concerned? So is it, for example, the surveillance of waterborne pathogens or the surveillance of extreme climate events? These are quite important, as you know, they are intertwined with these vulnerable populations. So where should the public health come in?
Yeah, surely. I always say that the most important thing is to catch it and catch it early. And where possible, make sure that it's not getting to people. So the elements around prevention. So if you look at the triangle of public health interventions, from primary prevention, secondary prevention, etc., I would want to say that the first element and some of the most cost-effective interventions are like, number one, public health communications. And I spoke about it very clearly: risk communication and community engagement. Let people know. Then number two, have systems which can be able to collect data, interpret that, and help us to prepare for any kind of public health intervention or eventuality, including how to actually prevent or catch it before it gets to people. So there are so many other public health, high impact, low cost public health interventions, but I will go with those ones. Others include like shock chlorination, make sure that the water which people are drinking is safe, etc. Yeah, sure.
Thank you very much for that. Perhaps let's go over to Dr. Frederick. Dr. Frederick, perhaps in taking over Dr. Martin has said now about public health interventions and communication. In your context, in the local context, do you have any examples of these effective communication strategies or effective community engaging the community that you'd like to share?
Yeah, as Dr. Martin has already mentioned, there's really a big room for improvement in terms of the way we are doing things. So far, as a country, we've been big on, mass communication. Whenever there are some of these emergencies, we actually get mobilized and together with partners, start communicating through its media, actually television and radios. But as you're aware, the country is really going more digital, and quite a big population in our country is accessing information through social media. So now we have recently shifted quite a lot to social media. We are trying to get the information out there through the Ministry of Health social media accounts, as well as the National Public Health Institute social media accounts. And we are glad that development and implementation partners are also on this, trying to send information out there. And one of the options that we are pursuing as a National Public Health Institute a bit more recently is engaging influential figures in these social media spaces so that they can have this information out there faster and most of the times more effectively, because people tend to listen to the people they find popular and reliable in terms of giving certain kinds of information. Even the ones that are a bit controversial could easily pass some information quite correctly if it's packaged well for them, and they'll pass it to a larger population than just the usual government channels that people sometimes distrust. All that. Yeah, so this is one of the areas that we are really trying to pursue. In addition to other systems that we have in place, we have a really revamped community health program with a lot of community health practitioners, or rather promoters being put in place and being used to send out this information right to the community level, which is something else that we are really working hard on. And finally, we are also going big on a new primary healthcare approach, where we are having this spoken hub model, trying to make sure that the lowest level facilities can easily be connected to the higher levels and information can be passed both ways more effectively, and not just information, but also referrals. Yeah.
Thank you much for that. So, if you're receiving all of this information as far as the public or the communities are concerned, how adaptive has the Kenyan government been in terms of factoring climate change into some of the WASH policies, strategies, and plans? Given that there's a strong correlation between the two, and now that you have information from the communities coming in.
Yeah, the government has been really supportive in terms of this. As you're aware, we just recently hosted the Climate Change Summit in Kenya early in the year. That was late last year. The government is actually keen on this, with the president being quite vocal on matters climate change. So one of the things that we've been working on quite strongly is making sure that the health conversation is incorporated in this climate change conversation, so that it's not only about carbon credits and the other conversations on climate change, but also the health impact of climate change and the way it affects the economies of the countries, the global south, and the various challenges that comes with it. So this is something that we've been working on quite strongly, with a lot of support from the government and the partners. We are quite hopeful on this because there's been quite a lot. A bit recently, we've seen even calls for research and various expression of interest for various projects being put out there to let people come up with research and activity interventions that can help reduce the impact of climate change on health, basically.
Thank you very much for that. Perhaps taking on, leading on from that, if I can come back to you, it is prone to flooding, and recent flooding actually has occurred this year. So, are there any lessons learned from that are put in place to actually prevent some of the devastations occurring? And what Dr. Frederick was saying now is that the Kenyan government is on board and they're taking into consideration all of these things. So, what are the strategies and what are the lessons on the call can also learn from in their own countries?
Was it that for me, Sean?
Yes.
Unfortunately,
yes,
I lost you.
Yes,
I lost you temporarily.
Sure, no problem.
Do you mind just repeating it?
So I can, from the conversation we had now, we learned that what Dr. Frederick had shared was that the government has been quite receptive to some of the information that has been generated. There's been talks of research and so on. So in Kenya, for example, we know that that it is prone to flooding with a recent flooding event that has occurred this year. So in your opinion, what are some of the lessons learned that you think, or some of the lessons learned, one? Secondly, what are some of the mitigation strategies that can actually prevent the devastating losses from floods? Yeah.
Very good. Yeah, good. So that's clear. Let me read out like what Frederick spoke about. I want to say that the Kenyan government is very keen on creating a very strong enabling environment. And we do have a Climate Change Act in Kenya. We do have very clear policies and strategies that are giving the country guidance. And from the Ministry of Health perspective, because I'm somehow involved in so many processes around that, I know that very soon we are going to release the climate change and health strategy that is going to give better direction in terms of how the country is going to operate in terms of getting into this space. I would also want to say that globally, regionally in Africa, the health voice within the climate space is emerging. And this is something which needs to be encouraged, because without speaking out, without demonstrating the health impacts on climate change, then, the impacts of climate change on health, then the interventions thereof cannot be implemented. So to speak, the lessons are like, climate change is here with us, and we can only move forward to start implementing mitigation and adaptation measures that help us to get out of it. But I'm happy to say that when you look at our INDR's integrated disease and surveillance response system, I think it's one of the areas where the government is investing heavily. And moving forward from our primary healthcare perspective, we have electronic data collection and collation system that is enhancing the reporting about different public health events within the community. So out of that, I think we are going to get information in a better way, and it will help the country to respond better. Then the second thing is around the investments, which are going to once mitigation and adaptation measures. I'm very much aware about programs that the government and partners have initiated to ensure that we have climate resilient infrastructures. So that's a very big plus when you're looking at Kenya as a country. And I would want to say that the only gap that we are having is not the gap around ideas. The gap is around investment. The gap is around how fast we can be able to move and build the infrastructure that is going to help us to address these challenges in future. Yeah, so remarkable efforts, but we still need to do more from the advocacy perspective, from the investment perspective, from engaging people's perspective, and also to ensure that the imperatives that are spelled within the enabling environment frameworks are actually monitored and will remain accountable to those indicators that we have committed ourselves to. Yeah, thank you.
Thank you. I do think that there's quite a lot of work that has already been done, and it's quite pleasing to hear that there are future plans and there are actually plans and policies put into place. Well, one of the participants asked, because we always, when we talk about we have these we are doing all these monitoring and evaluation of different points. Can you better explain or clarify the difference between waterborne, water-based, and water-washed related pathogens? So waterborne, water-based, and water-washed related pathogens. That's one of the questions from the participants.
Yeah, I can speak about that very quickly, and perhaps also share reference materials. Water-based pathogens are pathogens which you get out of interacting with water in an indirect way. Schistosomiasis, for example, is transmitted by Sacarius when you get into contact with Sacarius, but how the cycle goes is that snails are actually available in water. So once you interact with that water, then you get the infection. So that is water-based infections. Water-related infections are the infections that you are going to get because we have a vector that actually breeds because of the water situations. So mosquitoes breed because we have water collecting in pools. So that becomes a water-related kind of infection, including the Rift Valley fever, chikungunya, etc., all those kind of vector-borne diseases. Water-washed infestations, not just infections, actually infestations, like when you are talking about rice, piras, pumpis, tiras, all those kind of things, yeah? You wash them off. So when you have good enough amount of water, then you can use that water to, clean yourself regularly, and then you avert such kind of infestations, not infections. And then lastly, when we are talking about waterborne diseases, they are diseases that normally are spread because you are drinking contaminated water, cholera, typhoid, etc. Yeah.
Thank you. Thank you very much for that clarification. Maybe just building on that, Dr. Frederick, you mentioned in your presentation that there were, as far as cholera was concerned, there were higher rates in children. Could you just please give us more of a comment on that, please?
Yes. So based on the investigations that were carried out by the various teams during this outbreak of cholera in Lamu County, there were, the proportion of children among the cases of malaria was significantly higher. More than half of the cases were actually children aged between 1 and 10 years. And we found this a bit interesting. Now, we are still in the course of conducting further investigations with that. And I think there's a team that is working on something. Hopefully, they'll give us the results sooner rather than later. But the initial impression that we were having while on the ground with the investigation teams was that in that particular country at that time, there seemed to be a challenge with the consumption of water. It seemed like the children were more likely to consume water a bit more carelessly without, making sure that it's safe at that time. But there were also households where we noticed that they were consuming rather safe water, but then the water that we were using for other functions like cleaning the utensils, for example, for bathing and all that was contaminated water. So it was almost like they drink clean water, but they use unsafe water to clean the utensils and other things that is likely to get they're likely to ingest part of that, the pathogens that come with that. So that seemed to also be a challenge that could be associated with that. We still don't know yet, but we at some point had to revise the case definition for cholera for that particular outbreak so that we also capture children, because the initial case definition seemed to be leaving out children, because generally you tend to believe that diarrhea is a bit common in children. Sometimes water diarrhea is so common in children that you don't want to cause panic by suspecting every diarrhea case in a child to be cholera. But then we had to be more keen with these children so that we don't miss out on acute watery diarrhea and just assume that it could be rotavirus or other common infections in children. So I think this way we were able to pick out more cases by actually investigating, doing laboratory investigations for all the cases of children that had acute watery diarrhea in this case. We are looking forward to the final results to actually find out why there are more cases in children than in adults. Yeah.
Um, Dr. Frederick, if we just follow on that. So in this particular community, given all of the infrastructure, the structural, the limitations that are there. In your opinion, what would actually be the most effective way to either prevent the disease spreading in the first place? What do you think would some of those be?
Sorry, I think I have a connection problem. I can't really get you clearly. I missed the almost half of what you said.
I can repeat it. I said, when you mentioned now about the
Sorry, Dr. Martin, are you able to hear him clearly?
you talked about
No, we are losing Dr.
the young
Sean.
children that are there, and that they're obviously the ones that are consuming more of the water. So in your opinion, how do you think?
Sean, we are struggling to hear you. Your voice is breaking. Could you please maybe turn off your video, your camera? We have lost you somewhere.
Yeah, Dr. Sean, I think there's an issue with your connection. Both of us are not able to hear you clearly.
No.
Can you hear me now? Is it better now?
Clear. Yeah.
Okay, me now. Okay, great. Sorry, I don't know what happened there. Okay, so I think, Dr. Frederick, just a last question. So following up when you were speaking about that notice that some of the children, they were actually the ones that were drinking most of the contaminated water. So in some of these communities, considering all of the infrastructure and structural limitations, what do you think are some of the strategies that can be put into place to either prevent the children from contracting diseases in the first place?
Yeah, thank you. Thank you for that question. So I think there are quite a number of interventions that can be put in place. Now, Lamu County, which was the basis for our case here, is a unique one. It's probably one of the most hard to reach counties in Kenya. It has its own unique challenges. Like I mentioned earlier, even accessing most part of the counties is a problem. For you to get to the main island, which includes the headquarters for that county, you actually use a boat to cross over to that particular island. And within that island, there's no vehicle transport. It's purely on foot and using animals like donkeys. So that poses quite a number of challenges. That also means that there's no, piped water system that can come from the mainland to that island unless it's a major investment by the government, which at this point in time seems quite a bit of a challenge. And the fact that you have to use a boat to cross the main island means also transporting safe water from the mainland to the island becomes also quite a massive challenge. So one of the recommendations that we had at that point, and some of the things that we did while we were on the ground, was we just did some quick decontamination of the water. We learned that this particular setting has a strong religious component. It was quite easy to access the communities through the religious leaders and various religious groupings. So we measured on that and approached the religious leaders in that area to help us pass across the information on the need to use safe drinking water and also safe water for other domestic uses. So that's one of the things that we really need to capitalize on. We need to work with religious institutions as well as community-based organizations and civil society organizations to ensure that we can pass across the correct messages to people and to reach the communities a bit more easily. Now, the other thing that we recommended to the county government was the need to invest in a more long-term solution in terms of providing safe drinking water. Like I mentioned in that case study, most of the people in that area get their water supply from wells. And because of the high population density, the proximity of these wells to other things like the pit latrines, it continues to pose a real challenge. And Lamu County also has a very high water table. I mean, these wells are largely shallow wells. Most of them barely 5 to 10 feet deep. So that means that they can easily be contaminated. So there's a need for the local government really to find ways of providing safe drinking water. But apart from that, there are also infrastructural implications. I mean, the place is quite densely populated, and because of the challenges in transporting goods, it can really be a challenge providing this safe drinking water. Therefore, there is need to really take some drastic measures as well to probably enforce a way of letting people not dig up wells or pit latrines that are within a certain radius of each other. So this probably needs to be reinforced in that area so that even if the wells are there, they're at safe distances from the pit latrines and other sources of contamination. And possibly the local government can also find a way of setting aside certain portions of the land to just have wells from which it can produce safe drinking water and supply to as many households as possible. And we also need to, of course, do the most sustainable one at this point in time, providing necessary water purification systems and supplies to make sure that despite the challenges that are there, the communities are able to access safe drinking water. So there's a need for a lot of investments in that particular setting. It's a kind of setting that you find in most urban areas, particularly in the big towns and cities, in the informal settlements. It's a similar setting, more or less. So there's need for a lot of investments. There's need for really the government to look at health, not as an expenditure, but as an investment in itself, because it's only when people are healthy that they're able to contribute to the economy. And finally, there's need for a lot of multi-sectoral and multidisciplinary collaborations in this field. When it comes to infrastructure and other aspects of the environment, there are various other ministries and state departments that could be involved in this. There's the environment sector, there's the livestock sector that is also involved in this, there's water and irrigation, and I mean, there are various sectors that could be involved in all this. So there's need for further multi-sectoral engagements and to look at this issue as from a One Health approach to find practicable ways of dealing with it.
Thank you very much. We've come we're at the end of our session 3. I'd like to thank our 2 speakers for guiding us through this quite important topic, for sharing with us some of the basics, but also to share with us how the information can be applied, how we can address these issues both from a local perspective as well as a country perspective, and how each one of us do play a role. I think we covered quite a lot, from strengthening water resource management, health systems resilience, awareness and education, promoting surveillance, and enhancing multi-sectoral collaboration. So I'd like to thank a big thank you to our speakers, Dr. Martin and Dr. Frederick. That has been really fantastic. I'd like to thank everyone that has attended for all of your questions to keep the conversation continuing. As we know, water is fundamental to our health, and through all the work that we do, we all are involved. And through these presentations, we've really learned that there are some burning issues that need to be addressed on a community level, but also on the level of a country. And I think we've got 2 great examples from Kenya that have shown that there are some great strides being made, also in terms of policy and community engagement as well. So I'd like a big thank you to our 2 speakers, and as well as to all our participants. Please be reminded to do the survey after the session. The session has been, the link to the survey has been posted into the chat. Thank you all very much. We'll see you for the next session on Thursday. Just as a last reminder, the same Zoom link that you used to enter into this session is a personalized link. Please use that same link to enter our session on Thursday. Thank you very much, everyone, and enjoy the rest of your day.
Thank you, and bye-bye.
Thank you. Bye-bye.